So hello everyone. Epidemiology is the study of frequency, distribution, determinant of disease and other health-related states and events in specified population, and the application of this study to the promotion of health and prevention and control of health problems. Let us see all terms or definition for all terms like study, distribution, determinant, disease and other health-related states and events, specific populations, and application. So study means epidemiology is a scientific discipline, sometimes called the basic science of public health, and it has sound methods of scientific inquiry. And distribution means epidemiology is concerned with the frequency and pattern of health events in the population. This means frequency measures how many cases occur in over a given time period. Frequency pattern health-related events is related with distribution. So frequency includes not only the number of such events in a population, but also the rate or risk of disease in the population. So when we see the rate is a critical to epidemiologists, because it allows valid comparison across different populations. So the other very important epidemiological term is determinants. Determinants mean factors or events that are capable of bringing about change in the health. So any factors that leading or bringing change in the health system or in the health of the human being is said to be determinants. So an examples of determinants, like we can determinants are such as biological agents and chemical agents, and less specific factors like stress, drinking, sedentary lifestyle, and high fat diet. Biological are like bacteria, chemical agents are like carcinogens. This is all about the determinants. And the other one is disease and other health-related conditions or events. It indicates as the vast area is covered by the majority area or portion is covered by epidemiology. Some examples of health-related conditions are like injuries, vital events like birthdays, marriage and divorce, health-related behaviors such as sexual behavior, smoking, alcohol and abuse, drug abuse, and social factors like poverty. Pattern means epidemiologists describe these states in terms of time, place, and person. PPT, person, place, time. This indicates pattern. So the other terms of epidemiology is specific in specified populations. Also, epidemiologists and physicians in clinical practice are both concerned with disease and the control of disease. They differ greatly in how they view the patient. So the last term of epidemiology is application. Epidemiology is more than the study of something course, but as discipline within public health, epidemiology is a discipline which is found within the public health. So epidemiology provides data for directing public health action. So meaning epidemiology has theoretical as well as practical aspect. This is all about the definition of epidemiology. So who is an epidemiologist? Epidemiologist is a person who study about epidemiology. So a profession who strives to study and control of the factors that influence the occurrence of disease or health-related conditions and events in specified populations and societies, or that has an experience in a population thinking and epidemiological methods and is knowledgeable about public health and causal inference in health is known as an epidemiologist. So an epidemiologist is a person who has all these experiences are known as an epidemiologist according to these references. So epidemiologists versus clinicians. So when we compare and contrast clinicians and epidemiologists, clinicians are diagnosed patients, where epidemiologists are diagnosed